abraboni situation biya with a unique mentor, a colleague in a signpost team to Global Talent Visa. And a man the Global Talent there are three main categories. For example, for me say I had to demonstrate work I have done in Ghana. A few of the benefits na me make knows kakra say entire to any employer. And then over to me the family aba. And me say obi beka I am wasting it. Menkwana me that's when I made deep and
senior me link you obi am.
Hey.
So comment section nim na me link you.
We books and our books we are books in bro.
Keep watching. Keep watching.
Keep watching. Keep watching.
Keep watching. Keep watching and subscribe to Life Abroad 24.
Right. And see, the previous conversation, na how our friend be assigned postal to Global Talent Visa. So only interest our conversation so that we delve deep into the Global Talent Visa in general.
Okay. So before me call on friend signposting, me say you need to find your tribe, and your tribe doesn't necessarily mean say there's any panier Ghana. Me the first person that picked me in this country and started giving me opportunities or showcasing what I bring on board or your brony.
Yeah.
Me name that's a very close fan.
Mentor.
Yeah, my mentor. No. And I've had several mentors. And that is why you will learn about TB Jacks and some other people will tell you that abraboni situation biya one unique mentor. You cannot have one person that mentor you
all through.
No. You should have your academic mentor, for example, maybe your professional mentor, your spiritual, your financial. This other colleague in a signpost team to Global Talent Visa. And a man go shishwemo. Timi shishwemo na and your ma almost see or moji edma way ebebre go organo but some documentation and document you
requirements to the visa.
And you know Global Talent Visa no you have three categories.
Okay.
With the family knows kakra because we say UK government and your money knows kakra.
And I'm very happy we are talking about Global Talent Visa because Global Talent Visa is one of the visas here say juma employer Emma visa and as one sponsor once and what na juma. You are a man of your own when you have this visa. And they did also with immigration changes on my so far nyamiadum Yenyan says or touch Global Talent Visa. Hopefully they will not because it's very hard to get unlike the skilled worker visa now agency be creating your mouth and so here interview where there's an opportunity for you now all the tidbits around Global Talent Visa so in case na say interest or na so person UK assume dreamer will be peace you take that route and let's go on.
Okay. The Global Talent your three main categories.
Okay.
Your academic and research, your arts and culture, and your digital technology.
Okay.
Now see Global Talent now more two classes, or more leader or talent, and they have exceptional promise and as an emerging leader. So basically, you see that's why in your ma actually say can't any of these categories, whether academic and research, arts and culture, digital technology, will lead on a global level.
Okay.
And a global level means at least two countries should have benefited from your influence or your ideas or your work. At least two countries. And for example, for me say I had to demonstrate work I have done in Ghana and also in the UK. And say academic and research, you need to show that. Arts and culture, you need to show that. Digital technology, you need to show that.
Okay, until they will fall under the research.
Yes, academic and research. Now, in each of those categories, there are two ways that you can go in. You can go in by the endorsement route or the price route. And the price, I would say, so mostly go for people that sometimes are established leaders. And for example, if the British Medical Academy has recognized you for your impactful work in Sub-Saharan Africa, that alone, a prize award that will be demonstrated, say, we see.
We're a leader.
Yes. But the endorsement route, it's you need to gather some documentation. And all this information I make is on the gov.uk website. Or type of Global Talent Visa UK. It's straightforward. It will tell you what you need per your category, what you have to show, the documents you need to put together. And these categories now are more awarding bodies. There was a board side down. And the Mimi say how to apply to the Royal Society of the UK.
Okay.
Now they will review documents, and so we are happy say documents are already abandoning evidence, verify, it meets that standard. Letter actually say they recognize you as either an emerging leader or as a leader in your chosen field.
Okay.
That is the hard part. And to get that endorsement. Because after that endorsement, the UK government or immigration for are very happy most of the time to give you the visa. Because when you say you identify or say Sebio and you say Minya Vintina America, but what dream edo? Ana yensu yenim se dada nyina no omo no ompese omo sem dada. Intino omo peke say okay. Yehwe adwuma na wo ye na ahwa se yema wotena ha ebe benefit ye. Intino yema wotena ha suade ntimi mi say suade na research because yenim say anye kra no ade ba ko mienu bi a obeye den
ebe benefit no.
That is how it is. So it's an endorsement to keep omo ye promise. Training you kasa ntinu ma very careful na how obi akokase say
like omo ye careful say omo select omo a omo hwa da chi bi omo di bi brown.
Yes. Ntinu wo sa no yensa mfa adwuma mmara emfa nsan chichiro. Condition ba ko pe na omo visas ni nyina say won free her apply sportsmanship, sports job. Into ways where I apply, but whether say art and culture, say digital technology, say academic and research, body now or that category now, every review documents it take between 3 to 8 weeks. Whether you are applying from Hanuman, I say you are applying outside of the UK, and you can apply from outside the UK also.
Tonight you say, "Oh, Ghana, crown out, but so bring one." Where's my easy route? If you believe, say requirements, when meet or documentation, I train idea. But senior now, what I say, already requirements now meet it, but now we should need documentation and a back
Yes.
Because Ghana there, and I say, yeah, if we Africa brain now, a lot of things are impact I make it brain. We don't really have a documentation for it.
Good.
So how did you go over that hurdle?
So say me kaya me no man cut through documents be brain no. But nyame a almost is so boni friendly no abo na boafo. And then I make about challenges this life will throw at you. Some of the challenges our life may throw at me, made me land at the university to lecture. And the role now I'm a woman now and not as a standalone document. Now will wait. Because responsibilities no show. He said now I was already a leader.
Okay.
As a senior lecturer at the university. And then I could demonstrate other publications, other international collaborations.
Wait, a senior lecturer or associate lecturer?
Senior lecturer. I was a senior lecturer before I left the university.
Oh, UK Hanum.
Oh,
wow.
But I'm still an associate lecturer for them. Until last year I was a senior lecturer at the university before I left. before we figure out, I publish an emergency book and so for kids, which I
I remember that.
Yeah, I didn't get much support, and I came to school, so I said that, and all those had evidence, plus what I was already doing here, plus I had already worked at the COVID test center in the UK, so I had shown. I think I got one of the certificates from the former government also for my leadership and impact during the COVID pandemic. Okay. So national recognition in Ghana, some recognition here in the UK, doing some kind of senior leader job in the UK was enough documentation to suffice for me to cross. Okay. But so purely by peer review or more about a peer review, and not documents in here. For example, so we will say you are applying as a for global talent through the peer review route now. Unya nipa mienu a omobe endorse say ejuma waye ne any documentation. Okay. But me no fortunately no nyame adom na document ba ko ekura me mu edu na ejuma nkrata na me ya senior lecture no. Nti eno no boy. Right. Eno no boy.
Right. Okay. Nti senior na wo ka say all the core apply review no will take a while.
Yeah,
but then this time you had few days for obesano said that. Yeah. But then okay, so who apply obesa
yes.
You can still stay until you get response or feedback.
Yeah. Now me visa ni who Saturday amapa.
Right.
I put in the application Thursday evening.
Right. Okay. So how long I better you need? You can still stay anyway until
until you get a response. But again, nyame bonne ni fra for no a twini kura mabie. I think the following Tuesday or Wednesday. I got the feedback.
So about a week.
About a week. So I would say it's not also about just applying, it's about making sure you've gotten the documents very right. Because I can say nkrofo we am person or mo pay as or mo pay we say, you know. The other aspect I am who say omo system in place, which sometimes you have a tick box what you say. And or say me pe nyoma num we. E munye do say. Now what they always say if you see I can say numa ultimately na nko ebefa. And I said, "Midi nsia beko ebroso nti odeba no osi openum emunye do say this one the likelihood that your success rate is high.
Okay.
Yeah.
All right. And yes, why research na dear pet or arts and what?
Arts and culture. And film, fashion, architecture falls under arts and culture. Digital technology, AI, cybersecurity, fintech, gaming, research, we talk about health sciences, social sciences, medicine, engineering, humanities.
Simpacho, Ghana. Now, plan UK. I mean, I would advise, say, if you want to global talent visa, now you know. Call government
a website or gov.uk.
Gov.uk website. Na copy more information. Made the link, ever to my description box so that ever easier for you to go there. And that's it. So I share this very useful information.
Before a few of the benefits, na me make you know kakra said.
Okay.
Global talent visa, no, you did say rightly. Entire to any employer. And let's say me wo hoyi. And Kenya eja. My school fees in the minimum cash rate mom said man me pay na me tifi. But and then you can change your work. I'm not saying say unya be a driver yes because I know monitor how you use every documentation they give you. Until say global talent and say it goes against you. But one of the very good benefits is that after 3 years now, you can always apply for your leave to remain.
Wow.
So
that's beautiful.
So when you are applying for global talent visa, you can choose either 1 year, 2 years, 3 years, 4 years, or 5 years time open. May no me choose 3 years. It will be some say, now when your chance then when you see 5 years. No go few because we know you are seen as an independent applicant.
Okay.
Indeed, we health surcharge cry £1,000 for a year. Indeed, health surcharge for 5 years is saying 5,000.
But I don't know more advice I won't go 5 years.
Say usually in 5 years means no we are very sure say after 5 years Chrome had dear or IRL dear on Sadaka. But 3 years no, you need to demonstrate. Say 3 years no, or the I wouldn't say a strict rule, but amount for advice say 5 no. And then I will choose 3. But I've always said look at your situation. Because always Canada would be here for 5 years now, until you are 3 years now, it still gives you the potential to apply for your leave to remain. But also, I have a plan, as I said earlier. Meaning, the current time I pay 3 years. No, maybe by that time, I may swim my day. Now I can evidence 3 years now. The man, the team improve the system. Ejuma me yes, no, it is supporting the new NHS digitalization. We say, and I've always said you need to have a plan. And your money dear a beba and 70 dear beba, but once you have a plan you would always find a way to get back on route. And then over to me the family aba. And me say I am wasting it. Because Minkwana, that's when I made it deep.
And it's senior made kill beyond. Shall I not a single about church or comment section?
Masum do you hear me pan this year? Masum do you this year hear me pan?
But your subscribers no be better. But your what subscribing quite dear or chance? Draw comment section. Draw comment section. You know me link you. Over books and books in the right. Benefits very dear. Because I mean, looking at to say current situation, we are skilled worker crying now. Family member.
Yeah, but wait dear, you can bring your dependents with work rights and then particularly for me DNA once a some visa it is a nasa okotna outside the UK for a while it can affect your
yes. Maximum of three months in a year.
Yeah. Says that research travel. Time abroad does not count against residency for IRL. And you know, said you
what bread also
can you know my bread 6 months. I don't say me research home. It still counts in UK because I went through the research route. And you know it counts in me like you see I'm stadium is based in Ghana and it's a Kobasa Ghana 6 months it doesn't count against me.
Wow.
I would just stay there and then.
Wow. But the only global talent visa so now say for whatever reason, even if you are working for a Juma, you still have a time frame also returning. Because it will affect visa. So I mean there is meaning what is wrong about this visa, honestly. It looks like everything about this visa is just right, it's just perfect for wow, we are immigrants and opportunity way there, but do not let it pass you by. There's one last question I'm presenting this out. Say Uba Chrome has said you've gone through it all. In fact, just like you said, so you can say all the challenges life has thrown at you. Oh, UK has say actually you better not have my idea. So we're not going to delve deep into that. But out of it all, what crowning with? Maybe who is our crowning? I mean, himself there was standard, no? Standard now was September on the union right now. But you are currently a fellow. But what can I say? What are you now? What position are you holding now? I know you're a fellow of what? Oh, fellow
positions needed.
Okay, let's go for my white show.
Oh,
hey,
that. Well, when you say Nantegana, we usually just want to be known as Nantegana. I'm just a nurse passionate about building capacity to bridge the gap in health inequalities, particularly in resource-limited countries, Ghana or Africa or other countries. Based on the Juma Mayen or Ghana in disaster management, emergency, and even some I've done here, Hanum Macon Netherlands, to support them with emergency response and disaster management simulation. I got elevated by the Royal College of Surgeons, Edinburgh. I think that the oldest and largest College of Surgeons in the world, to the fellow of, so I'm a faculty for, a fellow faculty for rural, remote and humanitarian healthcare, which is nice, but it then brings that need to continue to impact rural, remote and humanitarian healthcare globally.
Hey, senior.
So basically, based on that, and I'm currently working in digital health education right now in the UK. Also, whilst a student, still a student, as I said, I am always a student. I'm always studying. I'm always writing something. I'm always reading something. I'm always looking for somebody to teach me something.
Senior, Bacho, meaning so kind of simple, fair enough. That is how you want to keep it. Bacho, my the details of it. What a day role na a play in your life when you become a fellow. How grand is it? Bacho, let us see the glory of this position. Don't just say it and throw it under the carpet as if it's nothing. Bacho.
A fellowship there, maybe magazine, in whichever faculty or specialty of practice that you find yourself professionally, fellowship is, I think, the highest. So me, for about a decade now, I've been interested in emergency response and disaster management in resource limited areas, so helping to improve all that. And per the work I have done over the last decade plus, the Royal College realized that I am making an impact in that field. So usually you can be an associate member, a student member, a member, or a fellow. But my documentation, I'm a presenter, met the requirements for fellows. So last May I was there. I would say it doesn't bring direct. I would say it doesn't bring direct benefit, as we always know, maybe because of that into Ubotuma increase. No, but it strategically places you. Strategically places you because, for example, some new big page must let's say, many big page more UN or WHO for a project in one of these rural health, and I have credentials that the Royal College of Edinburgh has recognized my previous work to the level of a fellow. Sabio, maybe unless but per that documentation and that those 6 letters now I will get a nod ahead of you. So it strategically puts you.
Video na I mean the video of the whole fellowship no.
Kwiruma, University of Science and Technology, Kumasi, Ghana.
But senior, one thing I don't understand is, as a fellowship, it's in a friend is saying, how do you put it? Is it surgeons or something?
Royal College of Surgeons, yes.
Yes, it looks like it's out of place,
So, colleges, from my little understanding, and as I said, I'm still a student. I'm learning all these things. It's a body of expertise. So they even have dental there. They have medicine there. They have disaster management there. So they have different specialties that, and like a group of faculties where they evaluate their work, continue to train people in certain specialized places.
Okay.
And it's either you are trained there or you get some training to attain, or you've evidence to say, although me nya kwan ni mo nsua de, but my nyoma a meeting more standards.
Maybe I didn't put the question right, because I'm a fellow of College of Royal College of Surgeons.
Edinburgh. Yeah.
So I'm surgeons now. I say this is a surgery, like Department of Surgery.
Yeah.
But then they're not quite as an emergency response.
Yeah, rural
Yes.
emergency response.
So why that?
So I want, if I remember very well, I'm say college in Shasia with that surgical focus.
Okay.
Because pioneers, were all doing theater. Like if you read into the college, the first fellows and members were people that made innovations in theater equipments and other stuff. For example, in the UK right now, we have the Royal College of Emergency Medicine. That is very specific.
Okay.
That is very specific. But that also, from the little I know, I'm focusing mostly on emergency physicians, doctors.
Okay.
We have the Royal College of Nurses in the UK.
Yeah.
That focus on nurses.
Yeah.
The Royal College of Edinburgh is a bigger, globally recognized, oldest, I think it's about 800 something years if I'm right.
All right.
That awards to every specialty in healthcare that they've been able to establish a faculty in.
Okay.
So first they need to have a faculty in, that is, they have experts who can assess experts.
Okay.
So right now I'm actually even in the process of assessing other people. So gradually we are also getting there.
Right. Okay. So it's not out of place.
No,
right?
it is very much. They started as a college of surgeons, but now they have so many faculties.
Right.
In there.
This is not making sense to me then. Oh wow! And congratulations again.
Oh.
But sure. Yeah,
Thank you.
you say the dear training suya, the dear limon nanti and I guess I can into no ye did what she. Yeah,
Yeah, Kobom.
Oh, see, I do what she.
Yeah,
Kobom. Oh.
Yeah, Kobom.
Oh, say how, then
Yeah, Kobom. It's a one needs to understand that that's what makes the community. So kasi udi mechia means me ko ana woba. But abrabono abrabono together.
Yeah.
So that is what completes the community, because se mimi jina ha hona ne baby epuno no. Hona ne baby window no.
Okay.
So it's not a matter of seeing say obedient, it's a matter of we are going together.
Okay.
But yes, because you go together no, near obi epuno no be pay first. But I know in say no chinchina enim dodo ana say no, it's just obi any timing. I know people that started before me, maybe my best sign or more in their profession, and I know people that are coming to do way more than I would be able to do. And the fact that me my shas doesn't mean say me him. And I've always seen myself as a trim when I say obia or prapra kwine. So I see myself as always opening, like I see things, I speak about it, I say, indeed, me prapra kwine emma. Indeed, me nkasa odi me prapra kwine
he's trying to be modest. By a
buono, me de me na pem me make sure me so that we do
okay. Yes, that's it. But this is him trying to be modest, and
this is me.
This is him. Anyway,
this is me.
Alright, yeah, that's it. But congrats again.
Thank
and
you.
We are I mean, when I saw the video, I was so delighted and say, wow, this is where you say some of us so
Amen. Now, let me say, me wo ade ba kwa me de beja omo wo hanom. In the UK ni omo venso from Ghana. So UK aban no alanche bibia your friend no there Fit for Future 10-year health plan for England.
Okay.
Obi a wo hanuma wo hwe adwuma wo pese okay maybe me pese me change me practice kakra maybe me mpe se metna clinical biem anase obi a opese uba inside no enyoma mienu na me de beja. One, you either have the skill that will fit into these 3 priorities I'm going to talk about, or you need to start looking for those skills.
Okay.
Because NHS no and I say health no baby a aircon any. Moving from hospital to community practice. So meaning that we want to try and treat more of young crofone in the community. So community-based healthcare.
Right. I think there is so much workload on the hospitals.
Yes.
And it makes
but
sense.
Apart from that, because of almost aging population,
yes.
and most of them are beginning to access sebi. So be who are only fee. Almost pumping a lot of funds into building capacity in the community. Meaning said there will be a lot of need for skilled workers going into the community. And so one per hospital, you want to start looking at what are the opportunities. How will I develop myself? And that is one thing that I will leave as my secret to people. I do a lot of self-development, learning and everything in private to wait for the opportunities. It's better say obey ready now opportunity now. They say opportunity beba.
Now when you're ready.
So that has been one of my mantras. Sometimes when you're my mission and say I'm fine Juma may but I'm not swinging it, if I can say that. I'm not learning it because it's for opportunity be beba. And as I did be I'm projected 5 years down the line. The next is analog to digital or more transition. There is a lot of digitalization, automation to improve efficiency. And last week I made a digital health conference, and I met some very important people. And you can see the drive is there. And obia all health all interest in digital stuff like health informatics, health data analysis, health research, health app building, like those kind of things. You need to either start upscaling yourself now because it's a 10-year plan.
Okay.
And the young friends are 2 years of crana they build on app. When you say I can 8 years, I would be to me room. And the reason why I'm saying it is that clinical skill visa nona to see a year soon. And this one put a plan in place to move healthcare in a certain direction, and sure, those skills will become key. Many profit there, but from where I sit and from the people I engage with, when we finish building the infrastructure, we will need people. And when I say, oh yes, smart now, what shall I say? Okay, so many skill we are, I say me then, me shall say upscale me home.
Okay.
Yes, why you won't no clinically no. One upscale on one. A bit to be ube unfit because any manually be a digital. No one could na or shall left or shall right and there's one to put on a machine and do juma. And the last one is from sickness to prevention. So they want to be more preventive in healthcare. Into things like early detection of diseases, or more biochemistry, genome analysis, population health, public health they want to look at how they can early on predict obesity, smoking patterns, mental health, healthy living environment. And these are the things I would advise you be a person or buy into the health sector. From now till the next 10 years, you should take time to read the Fit for Future 10-year health plan for England. It will tell you baby a year movie healthcare and might be very, very helpful in determining what you steadiness or how you prepare yourself. And you can. Thank you.
Yeah, that's it. Thank you for your time. And then, bye.